This is a short video explaining the correct method for using the bed alarm. Bedwetting is a fairly common problem. About 10 to 15% of 8 years old have got bedwetting. Using the bed alarm is an internationally recognized method for treating bedwetting, especially when it is an isolated problem, which means basically there are no daytime symptoms. Here I'm going to demonstrate the method to use one of the devices available on Amazon. This is the Dry Easy device. You can buy this off Amazon for something like 200 dirhams. But I must stress that this is only one of many devices available. Some of them are wireless, some of them are more expensive than others, but this is the device I currently have, so I'm going to demonstrate it. The principles for all these devices are very much the same. The principle of using this device is that it trains the child to wake up to void instead of voiding in bed. And this basically happens by this device sensing moisture. So when the child starts to void, this moisture sensor will sense the urine, and then it will sound an alarm and cause a vibration, which then should result in waking up the child. Oftentimes, especially in the first 1 to 2 weeks, another person will wake up, i.e. the parent, and that is because these children are known to have fairly deep sleep, which is usually part of their problem. So for the first 1 to 2 weeks, another person will wake up, but it's important that this person then wakes the child up and take the child to the toilet, and whether the voiding has happened completely or partially, it's important that the child sits on the toilet and attempt to pass urine, because this is how the training to the brain happens. The device comes in two parts. There is the alarm and the vibrator, and then there is the sensor. You plug in the sensor into the alarm like a phone cable, and then this is the moisture sensor. You apply that on a piece of cloth, usually the underwear or the sheets immediately underneath the child, and this is completely non-sharp, so there is no risk of this causing an injury. You apply this into the cloth, and then you apply the clip, and that secures it in place. And when this is exposed to moisture, you can see the alarm starting to sound immediately. This particular device is provided with a two-step alarm stopping process, so you have to unplug it and then you press the button for this device to stop sounding the alarm, and that's basically to maximize the chance of the device waking the child up. When you apply the device, it's very important that this is applied every night, and it's very important that should the child have a wetting episode early in the night, that the device is reapplied after that on dry cloth and dry sheets. So consistency is key. To call the application a success or failure, it's important to apply the device for at least 2 months before we call it success or failure. The success rate in studies goes anything from 50 to 80%, and to a large degree it is closely related to the consistency in applying the device. It's important when we apply the device to have a positive mindset. This plays a critical role in the success of application of the device. In addition to this, having a visual record of what's happening with the wetting episodes can be quite helpful. This particular device is provided with this little table, but you may well do something at home. You could draw it, you could print it out on a computer and add like little ticking boxes or something like this. But this particular device is provided with a diary that goes up to 12 weeks, which is then provided with little stickers that you could basically take the stickers and fill up the diary with these stickers. But again, you could apply this, you could design this at home as well. That's it for the device. It's worth mentioning that this particular device comes with a little clip that you could use to secure the device to the cloth like this, and with a strip that you could use to secure the device to the thigh or to some other part of the child according to what you find is more convenient. And thank you very much.